Live. Gonna do. I got Marcos Zottas with me right here over Skype. This is a brand new experience for me. I don't know about you, Marcos, but
I've had some work meetings over Skype or some other platforms, but yeah, in terms of talking
it's all
work,
about
yes,
the
this is
Zoom
the
stock.
first experience.
It's all about the Zoom stock. That's what it is.
Yeah, I was using what's the other one called from the US? I can't remember what the service was called for work, but I'm drawing a blank. But yeah,
Probably
no,
Zoom.
it's
Probably Zoom.
sorry.
It's always
No,
Zoom.
it wasn't Zoom. It was I'll have to look it up, but I don't remember the name right now. It was several months ago, more than 6 months ago now, since I last used it. But yeah, it's Zoom is, I don't know, Zoom is a little bit it's a little bit tricky for business meetings. It's not as secure apparently, so that's why we're using this different system at work. But yeah, I've done Zoom as well. But I personally prefer Skype. It's a lot better, in my opinion.
It's good that it's free. I remember I tried to use it once on my phone, and I had to pay for like these tokens to use it on
Yeah,
the
yeah.
phone.
Yeah, I don't know if, and I don't know anybody honestly that does that, that uses the token system, but yeah, I like the free option is pretty good.
So we're going to talk about the vaccine rollout. I'm sure that we both have a lot of opinions on that.
Hmm.
I'll just let you start with it. Do you have some favorites maybe? Because I don't think that all vaccines are created equal, because the preservatives in them, for one,
Hmm.
and just the delivery system itself. Like, for example, with the Pfizer vaccine, you have to be keeping, I think, at minus 80 or
70, I think it's 70.
minus 8. Okay.
I, yeah,
And so you basically have to thaw it out. And then obviously, well, what you have an extra process there, as opposed to if you have the Moderna vaccine, for example, right? It's not
right.
as it's just basically take it or leave it. And then the Russian vaccine. So you know that I have my
Sputnik V.
contacts. I have my contacts. And
Yes.
I'll tell you what's interesting is that from a retail perspective, the Russian vaccine is the cheapest. It's cheaper than
Right,
Pfizer,
right.
way cheaper than Moderna. Now, from the North American perspective, what we're getting, unless we can get some of that Sputnik V, my friend, but I would side with Moderna over Pfizer, and I've tilted so far to a degree where I would refuse to take the Pfizer vaccine if that was all that I was given. Like the local clinic was like, no, they're all Pfizer vaccines. I'm like, okay, well, I'll just wait for the Moderna vaccine. But my
Right.
whole thing is that with the side effects, I keep hearing this. First of all, everything is propaganda. There's no objective journalism anymore. It's all
No.
propaganda. And right now, the narrative that they're pushing is the side effects are 1 in a million, where that is completely a made-up stat.
Yeah.
Right now, the side effects, if we're being conservative, are, let's say, 1%. So if
Right.
I'm looking at the statistics on paper, and you have 0.1% for people who are from 20 to 50 who don't have diabetes, because diabetes is like half of the problem,
Right.
then, and if the side effects are 1%, and I'm reading those numbers correctly, and we're not talking about the health organization saying that 10 times as many people got COVID, right? Because then
Hmm.
you just have to divide all the statistics number, all the mortality rates by 10. But if we're not
Right.
doing that, then theoretically, I'm 10 times more likely to have side effects from the vaccine than I am to get sick from COVID. And for me, because I've had the flu shot twice, when I was
Hmm.
19 and 22, I looked it up. And both times I was basically like groggy and feeling like garbage for about a month.
Hmm.
So, and then the other thing is I've read that so we're not talking about the severe side effects. We're talking about just natural reactions.
Right.
A hell of a lot more than 1%, or this 1 in a million people, are basically getting like a light form of COVID after they take the vaccine. So they
Right.
get a rise in temperature for like a couple of days.
Hmm.
And so that's the selling point currently. And it's like, okay, but there's like about a 70% chance that I'm going to be asymptomatic and have no symptoms whatsoever. And then they did this test recently in Calgary, I think it was, or out west, where they tested specifically people under 30. And they had all these positives. And out of all the positives, I believe all of them were asymptomatic, every single one of them. And then the last point that I'm going to say is, with the vaccines, the balance is, what are you getting out of it? Because the hepatitis vaccine, like, there's people who are skeptics with the hepatitis vaccine, with the Twinrex, right, which is what we have. And I'm like, the benefits far outweigh whatever negatives you think you might have. Because first of all, you have hepatitis A and B, and you don't want to get either of those. Like, I'm sure that it's a very rare immune percentage, right? And the hepatitis B is for life, if I'm correct. It's just for life. Right. You don't take it again. Right. And the hepatitis A vaccine is supposed to be good between 15 and 25 years. Like, it's mostly advertised for if you get into your 40s to get the booster shot.
Yeah.
So I got it. I got it when I was in high school. I'm sure you did too, because I think we were just on the standard. So that's all fine and good. With this vaccine, first of all, we don't know anything out of 9 months at the most. And I think the Sputnik V vaccine with the Russians, I think that they have the longest trial period, and I think it's about 8 months.
8 months, yeah.
So you have nothing 2, 3, 4, 5 years down the road, and they're saying that the immunity period is about 2 years. So that means that even if it's all well and good, you have to get the shot every 2 years. So, and theoretically, if it's like 5% of people are actually just getting COVID, then every 2 years you get that vaccine, you're going to have 2 days of COVID to go through that. And then you balance that with between, okay, like, if you want to do it, fine. But then you have all the work stuff, and they're talking about the travel passports and everything like that. So anyways, I've talked a lot about that. I figured I'd just put that all on the table. And I'm not against taking it in general. I think right now, as terrible as it might sound to Canadians, the Sputnik V vaccine doesn't seem so bad to me in comparison to the Pfizer vaccine, because, with the Russians, they have a reputation, and this goes back to the polio vaccine in 59. They have a reputation of their doctors actually injecting themselves. And then that's how they actually lose. So all these people are saying, well, the Russians haven't done the proper timeline vaccines. I said, the Minister of Health injected. The Minister of Health injected himself and his whole family. Yeah. So they're actually the guinea pigs to begin with, and then they're like, listen, I'm just going to take the chance. Yeah. And then the costs.
There's no alternative, really. Like, what's the alternative to vaccines, right? You're gonna mask up forever. We still gonna have to mask up even after taking out the vaccine. But there's no real alternative. Now, I will say, trials need to be quite a bit of time. But what are we comparing that to? Are we comparing that to 1920, the Spanish flu? In my opinion, I think the science has improved enough where within 10 months you could probably come up with a vaccine. Now they're talking up, especially on the mainstream media, the mRNA vaccines, that it could be a cure for a whole bunch of other things. I'm willing to buy that because specifically I want to get back to work. Number one, to be safe at work and to keep others safe. But I also want to get to the bar. Let's be honest here. We want to enjoy life, right?
Like, I'm a Raptor season ticket holder, as you well know. Okay, yeah. And I advertise that pretty proudly, except for the fact that I've had like $7,500 blocked on an account for like a year now because I'm not getting those tickets, Marcos. And I want to go to the Raptors games, but I have the heavy duty, the air filter masks. So I would wear that to the game personally. I don't have a problem doing that for about a year.
And I don't understand why it's still kind of, I wouldn't call it draconian measures when it comes to sporting events or other things, but to me it's a little bit over the top when it comes to sporting events. I think you can have For example, Toronto and Tampa is going to be having 3,500 fans, right? It's Florida, I get it, but we could still fit it. But getting back to the vaccines, I personally think, like, I'm willing to buy that the science has gone forward where we can come up with a vaccine in about 10 months. But when it comes to the Pfizer vaccine, I have worries personally because they're talking about side effects for people who have food allergies, which I have food allergies. So it's a little bit concerning that stuff like that may be pushing the process back a little bit, because I've heard that they're going to have to kind of go back and retest for those types of people. So I'm more willing to take the Moderna vaccine rather than the Pfizer vaccine for that reason alone. I haven't personally heard any issues with the Moderna vaccine, but Pfizer has obviously rolled their vaccines out right now, and Moderna, I haven't really heard anything from Moderna. So yeah, Pfizer, I'm a little bit willing to sit back on it for a little bit. And obviously people are making a big deal, but I mean, we're not going to be, our age bracket is not going to be taking the vaccine anytime soon anyway. So, the health professionals, the elderly who are most at risk, and then people with compromised systems will then have to take the vaccine. So in my perspective, I think we have a lot more data that needs to be gathered. And yes, it is a bit of a risk without having those years of trials. But I think, with, like I said, the way the science has gone forward, the last 10 years at least, I think it's very possible that they've got something here. So that's my personal opinion on the vaccines. I think the worry is what they're going to do after, rather than with the vaccine. I think the vaccine is top notch, and really going to help people, because there's no alternative. I mean, if somebody can come up with an alternative, the skeptics can come up with an alternative to taking the vaccine, I'm all willing to hear it. But right now, there's no alternative to doing that.
Well, the whole theory behind it is, in terms of, and we're not talking about the loony bins, we're just talking about, just people who are overly cautious. The idea is that this vaccine, the effective rates are about 92, 95%. Right. Some people believe that it's essentially almost like an immunity booster. Right, because if we understand statistically that 99% of people recover, right? Yeah. Especially in the prime age group, then it's basically, and the reason that it affects elderly people more and diabetics is because they do have compromised immune systems, right? Right. So the idea is that if you have this super immune booster, I'm not going to say just vitamin D, but you know what I mean, and that is what this first round of vaccine is going to be. And that later on you're going to have, I guess, the vaccines that are going to try to maybe go more than 2 years in terms of the immunity factor, and once we get to that point, then what you have is you have a normalization. This is almost a trial period to see how many people get on board, right? Because the theory goes, if you got 85-90% of people on board with this vaccine, then that same number of people would be on board with a future vaccine. Right. And that vaccine might have, I don't know, fertility issues or whatever. The reality is that governments make mistakes all the time. And it's interesting to me that people always think that we're just progressing in this linear line, and then it's always going better. And it's like, look, I mean, you don't want to go excessively. A lot of the vaccine scandals that have happened is because the vaccines were compromised in one way or another. But that's the whole point with the Pfizer vaccine. The fact that it is in negative, you said 70, and that it has to be thought out. Yeah. I mean, how can you guarantee me that in that process, somewhere at some time, somebody's not going to screw up? And
you can't guarantee anything. That's the thing, right?
The Sputnik V vaccine, the interesting thing too about that one is apparently, well, we'll just go a little bit beyond that. That's the first bell. But apparently it's synthetic and it doesn't have the like the dead vaccine in it. Or sorry, right. the dead virus.
Dead virus, yeah.
So apparently this is why I'm actually on the like I'm gonna see if I would get in trouble if I said the V train. But no, listen, no, because it's Sputnik V, right? I mean, how could you not support it? But yeah, so with it being synthetic, it's basically, and that's actually one of the reasons they were able to develop it so quickly, because they were going off of earlier coronaviruses, and they're basically what it is. It is almost like an immunity booster, where it's giving you like a very small portion of the actual virus. So that's why they're having a lot less.
Right, the cocktails they were giving people at the beginning, right, were immune boosters, and that's what helped a lot of people get out of the initial hardcore cases early on in February and March, at least here in North America, were those cocktails. So, immune boosters, I think will I think help. In my opinion, these vaccines. They're here until we can find a cure. I know that's far too into the future, and I think it's very possible that there's a cure found to this, because if they've pinpointed already what it took them, what was it in the 80s? It took them like at least 4 or 5 years to pinpoint what HIV and AIDS were, right? Like it took that long. They've already pinpointed what the coronavirus is and what type of form it takes. To me, I see it's very possible in yes, every 2 years you'll have to take it. I wouldn't be surprised, but I think within maybe less than a decade, I think the cure is very possible, for sure.
Well, I'm going to pivot to another point that a lot of people I think are making fairly is the fact that you have AIDS, for example, where they've been working on a vaccine on that for over 30 years. And some people are saying, okay, well, it's nice that we've had this program in place with COVID and that will, in effect, help them with their vaccine research.
Right.
But it's pretty disgusting when you think that, those are probably viruses that we should have had a vaccine for by now, but they didn't have the commercial support and therefore not the financing support, because this is basically all out. And the interesting thing, too, historically is, so this is nowhere currently, like maybe it will be, but currently this pandemic is nowhere near 1919. And I was one of those people, I was prepared. I was like, this, because remember, we were growing up and the History Channel was running it. It's like all the next pandemic, we're overdue for the next pandemic. We're going to talk about 1919.
When's the big one going to hit, like the big week, right?
And this is, right now, it looks statistically, right? Like the 68 pandemic, which you can find articles and people can Google this, which was basically a worse form of the 57-58 pandemic. And they're different because one is an influenza and the other one was more of, I guess, just a different type of virus.
Epidemic, maybe?
Well, Again, if I get into technicals, I'm gonna make a fool of myself. But the '68 pandemic, basically, it was very much like this one, and it stated that it killed between 1 and 4 million people. I really want to know why there's this big variable gap, but let's say it killed 4 million people, right?
Right.
The world population was half that. So right now, for COVID to be at that level, it would have to be 8 million people. The other thing with COVID is that the World Health Organization said that 10 times as many people they think may have contracted COVID than the official statistics say, right?
Right.
And a lot of these people, it's not that, because there's a balance, and this is where the objective journalism comes in. You can say that there's people that they were on terminal or they were at a high risk category for dying from a regular flu, because people do die from that. They die from pneumonia.
Yep.
But because of COVID, they get registered as a COVID death.
Right.
And the technology that we have now, it's all the tracking software. So you go back to 68 and you're like, okay, there's probably a higher chance that back in 68, there were people that died from that pandemic, but they weren't registered, they weren't counted. Just like with the AIDS pandemic. Like to this day, how many famous celebrities, they were like, oh, we don't know. The assumption is that they died from AIDS, but we don't know. Now, with all the tracking, if anything right now, I think there's almost no way right now that we're overcounting the COVID deaths.
Do you think there's no way?
Undercounting. Jesus, I'm doing bad today. Undercounting. I think we basically done as well as we could to count all the COVID deaths. Right. So we're at the ceiling. So it's like 2 years after this is done, hopefully, we could have only overcounted. Whereas back then, they could have only undercounted just because they didn't have the resources to track it. So that's the first thing that I would say. And the second thing I would say is that a lot of it is genetic and immunity based. People, and I think this is fair game, to talk about how, listen, if we didn't have this percentage of the population that has, underlying health issues because of diet, right?
Right.
Would the numbers be what they are? Would they be lower? Because we do know that, if you're overweight and you have heart issues, or if you have diabetes, and diabetes is not always because of diet.
No.
But you have those factors. In 68, that was just a lower percentage of the population. So how much is that contributing to the COVID numbers too? And nobody wants to really have those conversations because we're all focused on the actual numbers. And I think it's the opposite way, because then you get into the Stalinist rhetoric where it's like it's all statistics. And every day they're talking about, like in the U.S., I mean, you can't help but ignore if you go on CNN, they have this giant number that says, now they're doing the ticker where it says, this is how many people have died today so far. Yeah. And at some point, it's like, are you trying to send a message where this is a serious virus, or are you trying to send a message where you're just counting the numbers? And you're almost...
Or it's politics, right? It could be politics too, right?
Well, I am very curious to see what happens.
Going to be there after January 20th.
Yeah. Well, I think, but my opinion on U.S. politics. I think they need a third party, So you want to talk about a little bit more about the pandemic, because the next topic will not have to do with the pandemic.
Okay. No, I just wanted to say that just about the things that you're talking about. Listen, the pandemic is it's here. It's what we have to live with for now, and hopefully it won't be for too much longer. But I personally see a light at the end. I'm normally not a glass half full type of person, but I see the way that things are going now, and I honestly see a light at the end of the tunnel. As odd as that may sound, are they overcounting the numbers? Probably. Are they, doing lockdowns to the point where they're destroying businesses? Yes. Are they doing it to be extra cautious? Yes. To me, it's not a conspiracy, but I think, the lockdowns by the World Health Organization's statistics aren't going to do much. That's the World Health Organization. They're saying the lockdowns taking place now after the initial outbreak are, yes, they're containing some of the numbers. We're not at 6,000 cases in Ontario, but we're still at 2,500 cases a day. And that's usually down to testing, right? They might not be testing as many people, right? It still might be the case where I think that they're underreporting the numbers in that sense, that they're not testing enough people. When in Europe you have rapid center tests, my question is, why does that not happen here?
Oh yeah,
Why
in
do
cars. Yeah,
why
you
do
got
we
the car
still use the
lineups.
method? Why do we still use the method of up the nose testing? Right, that's not the case in Europe. You look at these rapid center tests, you're in, and you know your results within a couple of hours. Right, you do a rapid center test in, let's say, Greece, right, a country that had economic problems. You do your test in a city center, in a tent outside, because obviously for health reasons, and you within an hour or two you find out those results. And I don't know why that's not available here. I think that would, like, if you can't just say that, um, the system is working well, that's why it's at 2,600, the lockdowns. The numbers could be a lot higher if you do the rapid tests, right? I think that's the more of the problem when it comes to the government action so far, is there's not enough testing going on, and we don't know the true numbers in that sense. The other stuff is, yeah, they're the in the hospitals, they're reporting it as COVID because, you have an underlying health condition, you add that to COVID, that has to go under, the death certificate, as I've seen it being explained by a doctor, that it has to go under COVID. Why does it have to go under COVID? The doctors have their reasons, right? It has to be, the paperwork has to be filled out, and that's why it usually goes under the COVID category. Now, they might have had a car accident and had COVID at the same time. Was it COVID that really killed them and not the car accident, right? That's what you really have to ask. But the other numbers, I don't have a problem with that. As long as they're doing more testing, the numbers will come out the same. I don't think the lockdowns, to be completely honest, with World Health Organization's guidelines, aren't doing much second, third time around.
Well said.